All right, so this is removable partial dentures review series number 5 for your exam. As I mentioned previously, this exam or your dental exam is easy if you focus on the right material, okay? And you have to use different study strategies, okay? All right, so review series number 5. Question number 22. What are the dimensions of occlusal rest preparation? So, in the previous series, we discussed about the rest seat, okay, and how you prepare it. So, what are the dimensions of the occlusal rest preparation? I keep repeating these things. So, if I repeat certain principles of RPD in terms of a question, then you know that is important, okay? Because repetition is how we learn. So I'll be repeating certain basic principles. So, what are the dimensions of occlusal rest preparation? A, it's 1/3 the buccal diameter. B, it is half the width from the cusp tip to cusp tip. The floor of the preparation is spoon-shaped and more than 90 degrees. D, A and C, or E, A and B. Okay, so our answer is E, A and B. Okay, so the dimensions of occlusal rest are both 1/3 the buccal diameter, and also it has to be half the width from cusp tip to cusp tip. Okay, so occlusal rest preparation, the dimensions. The marginal ridge reduction, as we mentioned in the previous series, has to be 1 to 1.5 millimeters. Okay, so you have to reduce the marginal ridge of occlusal rest 1 to 1.5 millimeters. And the floor of the preparation is spoon-shaped, but it is less than 90 degrees because it is spoon-shaped. Okay, so it has to be less than 90 degrees. If it is more than 90 degrees, it's going to be almost flat. Okay, so you can use a round bar to prepare the occlusal rest. You can either use a number 6 or number 8 round bar. Okay, and the preparation should be smooth, because if it is not smooth, it will be an area where food and bacteria can be trapped and cause decay. Okay, so the rest seat should be smooth. Okay. Question number 23. Which major connector is suitable for a severe gagger patient that has inoperable palatal torus and has deep palate? So if a patient has a deep palate and has a huge torus on the palate that does not need to be removed, what kind of major connector do you use? A, AP bar, or B, a horseshoe, or C, a mid palatal strap, or D, a full palatal strap. So definitely C and D are out. You cannot use, there's no way you're going to cross a palatal torus with a mid palatal strap or use a full palatal plate, because you won't be able to cover the palatal torus. And if you did, it would interfere with the patient's speech. Okay, so now we are remaining with A and B, AP bar or a horseshoe. So AP bar can be used if the patient has a palatal torus. However, if the patient is a gagger, then you have to avoid the epibar because the posterior portion of the epibar is going to cause gagging. So air is out. Okay, so we're left with a horseshoe. Horseshoe is also called the U-shaped palatal connector. So our answer is B. So make sure you know the indication of each major connector. Okay, so usually from the patient's standpoint and mechanical standpoint, a horseshoe connector or U-shaped palatal connector is the least desirable for maxillary major connectors. Why? Because it is less rigid. Okay? A U-shaped connector is the least rigid connector. However, if the patient is a gagger and there's a huge torus which you cannot remove, you don't need to remove, okay, then you can use the horseshoe or the U-shaped palatal uh, uh, major connector. Okay, so make sure you keep this in mind. So, all right. So, question 24: which of the following statement is true about the requirement for proper clasp design? All right, so you have to know a clasp design. You can't just make an RPD, put some clasp on it without knowing what kind of clasp design you're going to use, okay? So which of the following statements is true about the requirement for proper clasp design? A clasp should be passive at rest. B, a clasp should grip the tooth at rest. C, a clasp is active at rest. Or D, or the above. Okay? So I'll tell you one. So the clasp should never be active at rest. So C is out. And a clasp should not grip the tooth at rest. So at rest, the clasp of an RPD don't touch the tooth. Okay? It's in a passive position. So our answer is a proper clasp design. The clasp should be passive at rest. At rest, the clasp should be passive. Only when the occlusal forces are applied does the retentive and the reciprocating clasp engage the tooth. Okay? So make sure the proper clasp design. If the clasp is always active on the tooth, then you're going to cause periodontal problems, and that tooth is going to have poor prognosis. Okay. So make sure you understand the principles. So here are some requirements of proper clasp design. A clasp must be passive, and when the clasp is in place, should be no active forces on the tooth. And the retention is activated only when the displacement of force takes place. So when the occlusal forces take place, that's when the clasp engages the tooth. Clasp should never grip the tooth. Okay, keep that in mind. So make sure you review this series, this slide very well. Okay. All right. Question 25. The primary function of which of the following component of an RPD is to join the remaining components of RPD to the major connector? Well, this is a long question, okay, by design, but it is a simple question. So, what component of an RPD connects other components to the major connector? It is a minor connector. The minor connector connects other components of RPD to the major connector. So make sure you know that. Okay, our answer is A. Okay, all right. So you need to know the minor connectors, the purpose. So the primary function of the minor connector is to join the remaining components of an RPD to the major connector, and it serves to transfer functional stress to abutments. Okay. So not only does it connect all these other components, but also it serves to transfer the stresses to abutment teeth. All right. Okay. So question 26. On an RPD, which characteristic is primarily help in distribution of this of stress? Okay. So which characteristic of an RPD help to distribute stress? Is the rigidity of a major connector. You have to keep this in mind. A major connector has to be rigid enough, because if it's not rigid, the components of the RPD are not going to act as one unit. Okay? And so if it acts as one unit because of its rigidity, it's going to help distribute the forces, the stress. Okay? So keep in mind, a major connector has to be rigid enough to distribute the stress. Okay? So our answer is A. All right. So look out for the RPD review series number 6. Okay? So make sure you go, if you haven't reviewed the previous series 1, 2, 3, 4, and 5, make sure you review this series. Also, subscribe and click the bell so that you can receive the notifications for the upcoming video lectures. And so I'll be posting. Some of you have requested that. Some of you are enjoying the lectures, okay, which are posted on the website. And however, as some of you have friends who haven't been able to participate in the on the website due to different reasons. So we're going to be weekly. We're going to be posting some of these review series. Okay, so make sure you look out for them, and these are going to help you in terms of uh, having the basic knowledge of what you need to know before you take your exams. Okay, and this can be any exams in dentistry that is going to involve RPDs. Okay, all right. Keep studying hard, and make sure you study, take breaks, and test yourself. So every day, make sure you test yourself. Okay, so that you can internalize the information. All right. Good luck.